this is really an opportunity to help elucidate the thinking that was going on. It's hard. There was several hours of thinking, so it's hard to encapsulate that in a short period of time, but that's what we're going to try to do.
Hey, everyone. Okay, so Jim, we've got some new panelists up here. We've done completely, we redecorated this whole place here. So let me tell you a few things first of all. I want to introduce our panelists in a minute, but I also want to make sure you all know that this is really, this isn't just a fishbowl. This is an open fishbowl in the spirit of the day, which is to say that we really want. I'm not standing up there because I want all of you to join us as well, even if you're not a designated fish like all of us. You can be a temporary fish, which is to say that I'm going to go around and I want you to offer your opinions and such. So there's just a couple more things that I'll say before I introduce the panelists. I perhaps see our goal as to put important markers in place regarding what we're going to do and what we need to do moving forward. And part of that, I think, is to help elucidate what the state of California needs to do to make open data even more part of the fabric here in California. It's already really going in that direction, as we can clearly see from the last 2 days. But what else can we do? And I'd say as well, one of the other goals is to see how we else can take advantage of California's assets in this regard when it comes to data. When I think of assets, I think of what we've talked about throughout. For example, how can we have such this engaged and really intelligent, smart data community out there across the state? How can we really make sure that they're part of this as well? What aspects of this are we going to say that this is not just for government to do, this is for others to do? And secondly, how can we really sort of capitalize on the spirit of innovation and entrepreneurship that exists within the state that would really help make what we want to do really robust? So we'll start off with the first of ours in just one moment. I'll turn it over to you guys. But let me first introduce our panel. Jim Cashel is joining us, and I really appreciate that he's joining us. Rebecca Collias, who was going to be on the panel, had a family emergency, so had to go. Unfortunately, she's fine, but she just had to sort of take care of some things back in the Bay Area. Jim, however, is perfect. We've really wanted someone on the panel who can, you're perfect, great. No, we wanted someone on the panel who could represent the external view, someone who's not necessarily within government and who can represent those kinds of views. Jim and Forum 1, where he works, is the grantee of ours and done a lot of work with CHCF, but really has helped not just the state of California, but other governments and places like the World Bank, help them think through their technological needs, and has been doing a lot of work, particularly with open data. So great to have him. Thank you, Jim. Yeah. Elizabeth Baca. Some of you may know her. Elizabeth is not only a pediatrician, which I think is important for this panel for us to know, but she's also the senior health advisor for the Governor's Office of Planning and Research. Elizabeth's thinking a lot about the built environment and working with developers, local developers, for example, the planners, I should say, the local planners, who need to know about health data, for example, as they're making their plans. Then we've got Stuart, who is thinking broadly about open data across California. He is the one who is going to be trying to bring together all these cats and herding them in his role, which is the Deputy Secretary for Innovation and Accountability in the Government Operations Agency, which is a fairly new agency. And I'm sure we all know Mike Wilkening, who I'm really glad is on this panel. He's Undersecretary for the California Health and Human Services Agency. And he's really been the one, I think, most directly providing the leadership, guiding California's open health data efforts. So it'd be good to get his input on all this. So with that, I'm going to turn it over to, Toby's got the mic, so I'm turning it over to you. Fire away.
Turning it over to me.
And
Okay.
so we've got the recommendations on here.
For the strategy group.
What's that?
We're doing the strategy group recommendations?
Yep.
Okay.
So what we're going to do is we're going to hear your recommendations, maybe take 2 to 3 minutes, and then we're going to have the panelists, I'll ask some questions to try and help guide the conversation. And I might ask some clarifying questions too.
Okay, so we have four recommendations, which we combined several of our recommendations. The first was develop an operational model for institutionalizing open data. So that is really, kind of an overarching strategy. Align agency strategy with data-driven outcome measures. And as a part of that, we need to automate data publishing. Create and institutionalize outreach and engagement with stakeholder communities. So the big idea here was that we need a feedback loop. We need to communicate the story that tells the value of the open data, prepare for potential pushback against big data, and look for hooks as a way to introduce data in a receptive way. I mean, an example would be measles and the amount of interest we got on open data when measles broke as a story. And then determine demand and priority for data sets and support a culture of doing and results.
So let me start off, I want to ask a few clarifying questions because there are some terms here, and I understand this is a PowerPoint, and whenever you boil down recommendations in a PowerPoint to something that's, have to be in 5 or 10 words, it's hard to do, it's like a tweet. When you say operational model, can you give a little more details about what you're talking about, maybe make it a little concrete there?
You're looking at me for this one? Okay.
And it's okay if you say, you know what, we didn't get that far, that's okay too.
No, we got that far. I lobbied hard for the operational terminology there, coming from the project management discipline. So with regards to operationalization, we're talking about standard operating procedures, processes, toolkits, best practices that come from other sort of battle-tested fields and that have been iterative and improved upon in our operating environment.
Now, what about the other thing I wanted to ask about? When you say outcome measures, are you talking about health outcome measures, or what are you referring to there?
Yeah, so what we really wanted to recognize is that as part of the whole conversation, we need to build the culture within the organization to embrace the data and use it as part of the decision-making process. That data shouldn't be an afterthought. It shouldn't be something that we do sort of after we've done our actual work. Is that the work that we're doing really needs to be driven by the information we have tied to goals, priorities, processes. And so what we're really trying to get at is that if we're doing this right, we're really restructuring how we're making decisions through, top to bottom in an organization, really driven by goals, the information tools we have, recognizing that there may be some areas where we don't have good data or it's not timely or it's incomplete. But it really is rethinking how we're managing program based on the information that's available.
Okay, great. Okay, so let's get some reactions from our panelists first. I'm going to get some reactions from all of you as well, so be ready. But anything here that you wanted to underscore from what you heard and what you saw that you thought was meaningful?
I have the mic, so that means I get to go first. Well, Stuart and I were actually in the collaboration group on the same kind of working group, and I think what really stood out as you were saying those, I really like that a couple of them actually overlap with what we were saying as far as collaboration goals, even though this is strategy. I think the piece around institutionalizing outreach with community is really solid, and that came out as part of the collaboration to really make it, we have our, when do we share our taglines? But basically the people, like by looking at the data, you see yourself in the data. So I think that's really key. The other piece I think that was operationalized, I really like that because it's strategy with best practices. And as we were thinking of bringing that into the process so that it's not an afterthought, that also came out in our group. So I think that's really, I like that a lot. And I'll let you do the
Stuart.
The other side.
The other side of the downstream?
Yeah.
Okay, so when we're thinking about the communities, making sure that the data that you collect and the metrics that you'd like to propose for using it, that you actually go to the people who are represented in the data. And not in an individualized way, but as a community, and engage them in their community and ask them, look, this is what the data says, and try to ground truth it. Does this reflect the reality that you have or that you see? And are these are the metrics that we've pulled together through best practices? Are there better ways of doing this? Or are these the right measures, or are we missing something? But pull them in so that they feel that not only are they responsible for creating the data, but that they'll be affected by the outcomes and they can help shape those outcomes.
Do you, Jim, is there things that you see on this list that you look at and say, I see opportunities for those outside of government to help out and do some of this?
Sorry, Mike. Yeah.
You know, could we have one more microphone, don't we? Because I'm wondering, I can probably do the mic for the audience if people stand up when you have questions, and then that way we wouldn't have to carry these around. Sorry, Jim.
Yeah, so I think that's a really pivotal question, and it gets to this issue about how you're defining stakeholder communities. And I would say I've heard two schools of thought on this through the last couple of days. One is the role of government is to produce sort of clean, current data that's then used by people that are sophisticated around data to produce apps and other products. The other is it's to provide data for a much larger number of stakeholder communities, including the ultimate people that are reflected in those data. So if in fact, and I think this is actually a very pivotal issue about sort of self-image of government, is what is the role for data producers? If in fact the role is, our comparative advantage is to produce data that inevitably other people are going to use and repackage and tailor to specific communities, then that implicitly means you need partners. If in fact you want to try to serve all communities, then maybe you do or maybe you don't. But I think I think in many people's mind it's an open question still.
Mike, I want to give you a chance too to.
And I think, from my perspective, as we've been going through this process, we've been thinking about what does success look like in this space. And at the outset, success was kind of starting to get the departments engaged and starting to get data sets out there. And we've kicked around other ideas. One of which was I had some people that were advocating that a measure of success is apps. That people are using the data to develop applications. And my reaction to that's been that I think that that's good and useful, and I want that to happen, but can't be my measure of success, because for me it's too passive of a goal. I don't have control over that. I don't have the ability in state government to develop the apps myself. I don't have the resources. I don't have the knowledge. I don't have the skill sets. When we first put the DPH data sets out there, one of the first data sets was WIC data, and the civic community came up with Wicket, which is this great kind of cool app that will take and look where all the different centers are that take WIC payments, and also has this calculator that you can put in your information. It's a proxy, and you can see whether you might be eligible for WIC, and then gives you information on how to actually apply. And the chief deputy of the department told me, that would have taken us like 2 years to do. And I laughed and I said, you never would have done it. I mean, it's not your job, right? Your job is really to make sure that we're supporting the vendors, and that we've got the rules, and that we're enrolling people, and that the program's running. But developing apps is not in our skill set. And if we decide that we're going to try to do that, we're going to fail at it. So what we need to do is and I think that's a valuable thing to do. There has to be meaningful use for this data, but we need to produce the data. We need to make the data available, and then we need to make the connections to the community where the resources are that can actually develop that data into useful applications and meaningful use. And so we've been working with the civic community and the hacker labs and trying to develop those sorts of relationships so that we can talk to them about what's in the data, and they can come up with ideas on how to make meaningful use of it. But we're also starting to engage on a broader perspective, which is engaging some of the media, which gets to the broader public and seeing a broader distribution of our data, which we're seeing most notably with the immunization data, where you're seeing stories starting to be produced where They're looking at what are the immunization rates across the state in the various counties, the various areas throughout the state. Where's the immunization rate high? Where's it low? That stuff's all available now to people. They can just go onto the portal and start downloading our data and start looking at these sorts of things, mapping it out. So I really want to make it available and then foster relationships and an environment that allows people to use it and be creative with it. But I don't want to do all that myself or with my departments, because we just aren't going to do it well, and it's going to mean that we aren't doing other things that we should be doing. And also kind of gets, as I said in the opening remarks, I'm starting to also focus internally on how we use our data ourselves. And if I'm going to devote resources to bringing people up to speed on how to develop apps for external uses, I'm not going to be focusing on that aspect of it as well. So,
I think that you raise an important point there, that we might very well need some very broad metrics of success for the Open Data Portal, but it's not necessarily incumbent on government to meet all those objectives. Government has a responsibility, no question, for publishing the data and the speed, we'll get to that next, the speed at which they publish the data. But the creation of apps is perhaps something that really government neither can take credit for nor can, on their own exclusively move forward. So when we think about the metrics for success, I think we have to think about who's going to be responsible for the various metrics. I think that's a good distinction you're making, what you can do and what others can't do. Did you guys have a tagline? Did we talk about that? Is it up there? What's that? Oh, it's right there. California named healthiest state due to data-driven performance metrics. This is 3 to 5 years out, is that right? Is that what we're looking at?
Well, I'd like to push that maybe that's 18 to 24 months.
Next year or something. Now, go back to the other side. There's one other thing I wanted to ask you guys about. Prepare for pushback against big data. Let's talk a little bit about what kind of pushback could there possibly be about big data?
Yeah, of course. What could possibly go wrong, right? Well, I think sort of to Elizabeth's comment about allowing people to see themselves in their data, right? There's two aspects here, and one of the ways I want to think about this is value added, right? That there's a whole array of publics, of communities who need to see value in the state's data policy, either through kind of the external relationship, the apps, or the internal use. And if we actually want to support the growth of political capital, funding, investment support, the okay for these kinds of investments in time, money, technology, and staff, people need to be able to translate that work into something that's meaningful to them. And in some cases, it's going to be those communities of folks who are looking for, how do I enroll in a public program? In some cases, it's going to be our partners at the county level or providers. And in some cases, it's policymakers, both executive branch folks and elected officials. And so the more we can do to build understanding that data is useful for the full array of partners, the more we can sort of inoculate that process against the kinds of challenges that are clearly going to come along, right? But we're also concerned that as instances of hacking has happened in the private sector, people have not necessarily made a distinction between the kinds of risks that are happening in that environment, that are happening to them, and the kinds of risks that are happening in the public sector. And so rather than being reactive when something goes wrong, the point is anticipate that there will be setbacks and lay some of the groundwork of understanding around that so that when that happens, we're ready for it.
That's a good point. Okay, so why don't we bring up the second group, and while we do, thank you, Team 1, what are we calling these? Conversation 1, Group 1, really appreciate the strategy group. Any final comments from you guys about this one? Okay, Elizabeth's nodding her head.
I just had one question or one comment. I can't take the credit for Sonali's comment. That was our group work for the see yourself in the data. But I think it's a really important point because just as you were mentioning that, it kind of made me think back to one of the earlier panels that was talking about how decisions get made. And so having that community support can be really key for local elected officials and all the way up, and how it's prioritized. And there was a really great example, since we've talked a lot, and I work mostly in the built environment, in Fresno, that they actually used data as they were informing their planning process, and actually had the data as the piece that brought the community together to start to look at health outcomes and to look at these changes, and it created policy change as they sat with local electeds. And it just was a really powerful example of how having that data available really helped change the policy discussion. So I just wanted to add that.
Thank you. Great. Thanks, you guys. Okay, so group 2, we're supply and inventory now, is that correct? Okay. Supply and inventory. We have 3 fish who want to join us, and while we're doing that, while they're coming up, please stand up if you have any comments about this, or there's actually a free chair over here. Anyone want to add in anything, chime in at all? All right, we'll get you later then. All right. So you've got your slides up there. Tell us what you're going to do to improve the supply and inventory of data so that I, for one, stop getting complaints about how data are 4 or 5 years old and therefore not useful. Go for it.
Okay, so funny story. I looked up here yesterday when people were hanging out on the couch and with the microphone, and I said, that'd be kind of cool to do someday. And then today. Yeah, exactly. So a little bit of my background is I'm with OshPod right now. So some of this has already been done. Some of you may be looking forward to some of this. I'll start with number 1, visionary leadership, support, and accountability. That starts really from the top. I have to say that Scott Christman, our CIO, really, really crucial. I mean, when he comes in and he talks about what we're doing and where we're going, it's very, very important to us. If we didn't have that at the top, it wouldn't trickle down. Number 2, resources and expertise, skills. Do we have what we need to do this? Do we have the money? Do people have the time? Do people have the knowledge? Clean data. Time and time again, we get data from different departments that's formatted with bold text and, yeah, you name the gamut. Number 3, standards. So that goes then into the being able to have the clean data. Do we have standards that says, what the metadata should look like, what the data dictionary should look like, et cetera. And then down to number 4, the robust governance processes. Once we've developed those standards, are we giving people a huge packet of what to do, or are we handing them a template? I know that with OshPod we have a metadata template that's really effective that we're giving out, that you pretty much fill out what you need to, and then once you get on to uploading your data, it's right then and there. And the number 5 is to prioritize everything. I don't remember those last 3 bullets. So we looked at, what are you going to post first? Low-hanging fruit. If you're already putting it out there, then put it out there on open data. What's next? What are people looking for? Put that up next. So this is what we've come up with.
And let's see a tagline too.
Oh yeah, so our tagline's less of a headline and more of a Open California, made fresh daily.
Yeah, I saw an iteration of that was, I think, Open California refresh daily, as well.
It's supposed to be refresh, yeah.
Yeah, okay, all right.
I just read the slides.
Any other comments from you guys? Why don't we go back to the other? Thanks. Okay, you don't need to. Yeah.
So there was a bullet up there that ended up as a fragment, the learning part. And we talked a lot about the need for essentially like laboratories, which is sort of a buzzword, but we can define that as time and space for diverse perspectives to gather together and collaboratively diagnose problems and imagine solutions. And it's really important to stress that there is not such time and space for that within institutional structures under business as usual. And it's really something that has to be created. And so there's the need for capacity within institutions to participate in learning activities and capacity among institutions that can create that time and space and support people to step out of their specific narrow roles and actually engage with other people who have different perspectives over time. like sustained, intimate versions of all this. I have other things to say about standards.
Good.
Uh-oh.
The thing about standards is that we need them. It's really important. But there's often the sort of first to market wins and becomes the standard challenge. And much like any kind of resource that we share, standards are essentially a shared resource. It's really important that the structure of those standards is accessible to and revisable by the people who are actually impacted by it. And so when we talk about standards, we should make the distinction between standards that are essentially owned by a vested interest that cornered a market versus standards that are essentially open, free to use, and also changeable by the people who are impacted by them.
Good. Let me pick up on that standards thing. Stuart, I'm going to ask you a question, and I don't know, and others people can feel free to chime in. Is it incumbent on government to create these standards? On California, is this incumbent on federal government? Is it incumbent on Code for America and those kinds of places? Who's got responsibility for the standards?
I thought I had the answer for that, and I don't. And here's why I don't. I think standards are changing. I've watched Socrata come in with their standards. We've certainly had a lot of discussion about what kinds of standards there should be, and I'm feeling that a minimalist approach really is probably useful for getting as many people on, although I do realize that the more robust the standards are, probably the more you can share data more broadly, but I mean, that's kind of the outside of the envelope of my knowledge on that, but I think we'll be having a lot more discussion on what standards should be and what we need to get started. I mean, actually, I think the most important thing is to get started and to get the minimum amount you need to get going and then build on the fly. One of the things that is hard for large governments is to iterate, and I think that's a habit that we're going to have to pick up, and I think that process will be helped.
It's just to pick up a little bit on that, to iterate because they're large, obviously, but
well, because you're not. I mean, it takes too long to build the perfect thing when you haven't done it before. B, things are changing, I think, so fast that you want to be able to be able to add new things that come in, and I think you need to have the opportunity to have feedback from users to make it better, and early and often, and then flexible enough to change.
Mm-hmm. Yep.
I'm just going to say, I think that gets to what your point was, as far as if we would have done this within house, it would have happened in 2 years, and then it probably wouldn't have happened at all. So I think, and one of the things is especially working with a lot of the local governments, from what we've done is we've looked at a lot of the partners who are doing this work on the ground to learn from what they're doing, because they have been able to do a little bit more of that iterative process, as it wasn't this huge approach of everyone has to do it this way and then figure out what didn't work or what did work, but kind of more from the bottom up.
Okay.
Michael, do you have?
I was going to ask you, Michael, in particular about so one of the recommendations, number 4, is about government processes, which I know have been put in place, are being put in place. And it struck me that there's a lot of things on this slide that are perhaps in process right now.
Yeah, I think as we were embarking on this, and this was part of the, I said I'm a open data convert. Part of it was this. So I wanted to know what were the processes and procedures that we were going to use to put things onto the portal. What sorts of assurances did I have that I wasn't putting up personally identifiable information? How was I going to be able to replicate the process across my departments? And there are different approaches to this. You can kind of start and just say everything goes up on the web in a month, right? And that can be the decree, and you can do that. And there's a certain value to that. You get people moving, and you get a bunch of people moving at the same time. it's not the approach that makes me comfortable. I'm much more in the mode of kind of let's make sure we've got the processes and procedures in place. We know what we're doing. We know what we're biting off, and so that's how we approached it. We also, there was a lot of talk about standards and what to do relative to standards, and that's where my impatience came out, which was, we could talk about standards for the next half a decade, and I'm not sure that we ever would have reached any sort of an agreement and would have been absolutely nowhere. So I just said, move. Start, just where we are is where we're going to be when we start, and we're going to have to be flexible as we go down the path, and as things change, we're going to have to adapt. But that's where kind of the Open Data Handbook came from, is we started looking around, and New York had one. We started adapting it to what our circumstances were. We started very incrementally with the department that was most ready to go and most anxious to go. So we started with public health. Public health has lots of data, and they really like having it out there. They like having people use their data. They're very proud of their data. It's an easy department to start with. So you start with them. And you start with a handful of data sets. We could have said everything that you've ever published, put it up tomorrow. We didn't want to do that. Instead, we wanted to actually be methodical and go through the data and have as clean a data as we could when we went out. I also very much wanted to have the data dictionary done. So I wanted to know, if I wasn't going to be able to standardize my data, or if I wasn't going to be able to really kind of change the data, what was there? So clearly define what it was that we were putting out there. And then, that makes it easier for us down the line. If we have to adapt, we need to change, we know at least where we were. It makes it easy for researchers, if they're looking at our data, to know exactly what it is that they have in front of them. People that know what they're doing with data, it makes it easier for them to figure out whether they can combine the data sets and what sorts of results they're going to get out of them. So we did that with public health, and it was very kind of methodical and fairly slow process. I know people have been saying how quickly we've done this, and it didn't feel real quick to a lot of people that I was dealing with. They felt I was going far too slow. But my feeling was, do public health first, get a couple of iterations under our belt with them, test out this Open Data Handbook, test out our processes, move to another department, which was OSHPD, make sure that that data handbook was able to transfer across and was general enough that it would apply to another department. And then I've told my departments at that point, the pedals to the metal, start moving. I want departments coming up quickly after that. I want departments that are already on there accelerating the number of data sets they're putting up. But I wanted the infrastructure in place first and test it out and then start moving. So that's the process that we've used. And so, a lot of the things that I see up there, either we have some version of them or are in the process of developing.
Jim, I think I recall some conversations that we've had about how the role that those outside of government can play in expressing their opinions about what data should be released and how best to do that, what's the structure look like. We've had some conversations about, in essence, what could be like a health data guild, for lack of a better way of describing it, of professionals and others who can help advocate for issues and use the data and such. But what role do you see for those that are not within CHHS, or for that matter, the state of California, to play in this process?
Start filing FOIA requests, like
that's right.
Nurov said yesterday. Yeah, it's a good question. I did want to comment briefly on sort of building on Mike's comments, that this list at the federal level, this list very much reflects what happened there, but there was really another ingredient that I think was pivotal, which was deadlines. And I'll tell you that there were executive orders and there was a lot of cajoling from the White House, and huge, the energy department and HHS, and they were taking these quarterly release schedules really, really seriously. And, a lot of these other pieces were in place, but, I'd try to get meetings at energy department on projects that are underway, and they're like, sorry, we have a data release this Friday. We're booked. Mike very understandably reflects reluctance. He could just start ordering people, but he's not going to do that. But the irony is, in some ways, it makes people's job a little bit easier to actually have at least soft deadlines or guidance. As these things are laid out, Lynette Scott's going to take them very seriously, and she's going to talk to Angelique and Adriana, who are the people that we're talking about. They're sort of the heroic front line of putting this stuff online. And if they know they want it by last Friday, things happen. So anyway, it's a balancing act to figure out how specific to be around that topic.
That's a very good point.
With respect to feedback, I've seen a lot of project ideas and proposals and initiatives around data prioritization and feedback, and especially at the federal level. And I have to say, I think this is a nut that hasn't been cracked yet in really a very useful way. There's an organization in DC that I think they're called Open Data Enterprise, and this is what they do. They set up roundtables of users of different data across different verticals and meet with the data owners in government. So there's that model. There's been online models. There's been survey models. And I haven't really seen, and maybe somebody in the audience would have better information than I, but I haven't really seen a good ongoing mechanism. Even the Socrata invitation to suggest data sets that you'd like to see, I think isn't used that much. So it's a good question, and I think it's still an open question.
And I just want to pick up really quickly on a comment you just made, these frontline heroes, because they really do deserve so much credit. The folks that are within the programs that have the data, who are really sort of, whether there's a deadline or not, but working hard to make those data public, deserve so much credit. And we really should take a moment and thank them publicly for what they do. I remember when CDPH had their first soft launch the data portal, they invited some of those folks to come up and explain the data that were being released and explain the meaning of the data and why it's so important. And I thought that was really nice, to have those data heroes, give them an opportunity, and perhaps that's something we can do going forward in venues like this. So any questions, pushback from the folks in the audience? Yeah.
Comment, Andy, up here too.
Yeah, why don't you go? I'll please comment, and I'll walk over there. Meanwhile.
Yeah, so my gears started turning in my head when I was thinking about it, because I am on OSHPOD's leadership and administration for the publishing. It's only been about 2 months or so, and so I'm gathering all this, and I noticed that a lot of it was lining up with what's been done. And so I just kind of wanted to comment on maybe that there's been a lack of, at least for my group, it seemed like they didn't know a lot of this was already in place. And so maybe there's just a communication thing that we need to push more of it and let them know that, a lot of it's coming.
So for the panel, it overlaps with the strategy, but thinking about, and it's kind of building on Andy on your question, particularly around thinking about healthy communities, and we're thinking about different data sources. So I think we have, and we're already using some of the great data that's been put on the portal, but as we think in a lot of the conversations that have come up around walkability or energy usage and energy efficiency or climate change and how that relates to health, what are your thoughts from the discussion of the group of how do you get some of that inventory collected from other agencies?
My main response is that a lot of the data that's really important to understanding the health of communities is not necessarily data that does or should come from government. There are community organizations working on the ground that have their own means of monitoring the health of their communities. And the next level of these conversations may be to think about how to bring data into the public realm from non-governmental community-based organizations about important things like that. Public Laboratory is a good example of that. They do sort of community-based environmental modeling and monitoring. And I think we need more examples like that where data generated from, whether it's the grassroots or the NGO field, however you want to call it, can be sort of validated as public information.
I really like these recommendations, especially the fifth in terms of prioritization, but I wanted to see if I could get any traction on the idea that sometimes it's going to have to be the high-hanging fruit that we go after. The worst data, the least available, and the most intrusive data may often, I think we're going to find, have the highest payoff. That's not low-hanging fruit. And if we keep going after the data that's out there and not worrying about the data that's not very pure or not at all in existence or intrusive, then we're going to do the easy stuff. And the easy stuff will be easy, and we won't engage on this question we raised earlier about intrusiveness and the political capital that we need. So I want to make sure that we know that open data matters tremendously. There's some data that isn't yet open that is arguably very, very important, and that we need to worry about that as well.
Any comments? The tastiest data being on the top of the tree? Gotcha. But before we do, any comments on that? Nope. Okay.
Amen.
Here we go.
Piggyback off you, sir. I understand a high-level data, and I'll tell you why. I'm a child abuse investigator, and I go to people's homes where children have died. When I'm walking in there with law enforcement, the coroner, then I go to the hospitals, and I'm holding a child in my arms, I guarantee you their parents don't want that information out anywhere. So, from my perspective, I'm all open for open source. I'm all open for hackathons. I participate in them. But I'm very, very careful what I hack. Very, very careful what I do. Because there is safety, confidential issues that we need to be cognizant about. In terms of standard, I do believe there should be a standard. Why? When I get sick, I go to a doctor, I'm expecting that person to have a standard. When I see a social worker from child welfare, I expect that social worker to have a standard. So when we're looking at high-level fruit, from my perspective and the things I've seen, we need to have a standard because there's issues up there we can be very careful about.
Mike, this strikes me as a good opportunity to talk the tiers, perhaps, of...
yeah. I was going to say it's... We've focused right now on the open data portal on the things that are already available publicly. So in the three-tier system, it's tier 1 data. Tier 3 data is the personally identifiable HIPAA data, which is very clear in our handbook and is been very clear from me, will never be on the portal. That's information that we gather, we use to run our programs, we use to provide services. What I will tell you about that, though, and this again gets back to my idea of the external versus the internal, and I'm kind of dividing my attention between the two now and looking at how we use the data that we have internally, a lot of which is personally identifiable information, HIPAA information, and we don't do a very good job in using that data internally. It should never be external, but we don't do a good job using that internally to really look at our programs, to look at how we operate, and to better provide services to people. And we don't do a good job in sharing it across the departments in appropriate manners. So those are the sorts of issues that internally I'm starting to look at, and those are ones where I'd say that's the high-hanging fruit from my perspective, is really looking at how we use that data internally. I'll also say that we're in the middle of the Let's Get Healthy California effort, and we have a series of indicators that we've adopted for that looks at all sorts of different indicators of community health and trying to really push California to become the healthiest state. And those indicators are they'll be publicly available, but they're going to be driven by, in some instances, data that you can't put out publicly. So there are going to be individual level indicators that aggregate up that are going to be used to help figure out whether we're achieving those goals. So I think there's a whole stratification here on how the data gets used and what the appropriate audiences are, with the ultimate goal of across all the levels. I think we need to improve how we use the data and I think one of the things that I'm seeing in this effort as we've started focusing on is that we're really paying more attention to what it is that we're collecting and what shape it's in and how it can be used. And so that's one of the benefits I'm seeing across all the levels of it.
Great. Thank you. Let's bring up group 3, please, which I believe is the Improving Skills group. All right. Leslie, are you the spokesperson?
I guess.
All right, why don't you walk us through these?
Okay, is this working? We came up with 5 recommendations. Essentially, what we're looking for was the role of philanthropy to convene a core data analytic competency group to establish a set of competencies that could be used across different disciplines so that we're all speaking the same language. We can integrate this, we can train to it, and if we have a core set of competencies, then we can start with institutional change. The way you get personnel change and everything in government is you have a defined skill set that's required, and that goes through, and then you can get change all the way up. You require it in graduation all the way through. So we want to incorporate science and training in all levels of education. I'm sorry, data science, that's supposed to be. Mm-hmm. Although science would be good. What we want is to make sure that we're teaching this in elementary school. We're teaching critical skills at the lowest level to carry all the way through so that we wind up having a workforce that's ready and able to actually understand the massive amounts of information that are available and make sense of them. We want to foster open discussion, really talking about peer review so that I can talk to the person in the next cubicle about what I'm doing in terms of, do you think this is the right analytical approach? Do you think maybe, is there something else I could be doing? Gee, you're working on a similar project. Can we maybe maximize our efforts and work together on this? So the idea is fostering not competition between coworkers, but collegiality. And also, to help us make sure that we are saying what we mean, that we're doing it correctly, that we're catching mistakes before they get out into the big wide world. That we also develop a system or implement a system for data stewards or liaisons to do departmental level training and projects so that there's a core group within the existing organizations that know something about data science, even though we haven't gotten them fully through the whole educational process. They may actually already be working there. But it's a way to get people to a skill set and begin to basically institutionalize this skill set. And then lastly, we want to work on advocacy and public engagement campaigns on open data, and also on citizen engagement to provide an opportunity for people to maybe identify what problems they're having, whether they're the general public or they're researchers or they're even folks working with open data in a government or institutional setting, and basically create an open dialogue around, gee, what are the issues? What data is available to solve it? How can we begin to look at this? And our headline was, Data Literacy Drives Business Change.
Great. Any other comments before I turn it to the panelists from either of you guys? Leslie covered it. Good.
What's interesting for me is that actually the two prior topics really fed into ours. And actually what they were working on and building up to is really a multidisciplinary approach and a collaborative approach in regards to data analysis and review. And then making sure that goes forward so that not only are the competencies maintained, thank you, but also that the confidentiality and that the respect of the individuals are also supported.
Yep. Okay, so let me turn it over to our panelists. Thanks to you guys. I'm curious if there are recommendations on here that you look at that you think would really be worthy of lifting up that you want to comment on and talk a little bit more about. Any come to mind? And I was just open to anyone, starting with those, I guess, who have the mic right now.
Yeah, sure. I think it's really fascinating to see how it's emerging. Especially, we were at the last group, but I think as we look through, it's a matrix, bi-directional matrix, going from the top and then over the side to see what overlaps. And I think a lot of it. I think the piece on citizen engagement is really key. The piece around discussion and the multidisciplinary. I walked by your table earlier and was like, this is fantastic. It's really challenging. So I think it's great. How would you incentivize the multidisciplinary piece? Because it is working with other sectors. Did you guys have that come up in your discussion?
Okay. Basically, this becomes a skill set that everyone has to be able to speak the same language as we talk. Otherwise, we've got economists working in one area, planners working in another, public health people off on a different route. And if we don't have the same language, we can't talk to each other. If we can talk to each other, we can figure out that the problems in public health may have something to do with environmental influences, or they might be the asphalt the planning department is approved for the road repair. There's just a whole variety of things, but if we don't have common language and opportunity to talk to each other, then we're never going to get there.
Did it come up as to how you would start that conversation to get to recommendation number one?
Either you want? Okay. Go for it.
We have a fish joining us.
Yes.
Oh, a new fish.
So I was just going to add, one of the things that we talked about in terms of incentivizing was getting the mind share up front. So we talked a little bit about the example that Stefan gave and kind of doing a kickoff activity and defining how these were relevant, specific to different roles. We had a little bit of fun discussion around some of the cool infographics that we saw over the course of our time together. And what was neat about those was we didn't need different words to understand. The data was objective, and we, from our own perspectives, drew our own conclusions. And so that was kind of cool. We thought about, could we create an infographic that was sort of demonstrating the why for open, so that different groups could look at that data and the problem and sort of have a shared understanding of the problem, but it's one that's relevant to, again, their own perspective. So we kind of talked about how, well, if we were going to explain that in words, boy, that'd be a whole lot of training, and what would that really look like? So I don't know if that totally answers it, but we did talk about just this need to kind of get the energy around the why up front and how to maybe frame that.
Great.
Yeah, that's great.
Other comments from other panelists?
I was just going to jump in on a more practical level, just real quick. This is something that different groups do differently. In San Diego, we have multidisciplinary groups that meet all the time. We have one on data that meets once a month. And so there are ways to do it and do it successfully. It comes from direction from the top saying, you know, you guys need to do this, as well as people just having exposure and opportunity to each other.
Is that part of the regional collaborative with the Department of Health, the data work group?
Actually, it's more internal staff, and it's just kind of spread. Groundswell, I guess, is what you would.
My only thought is we have been betting on a number of fronts on the power of generational change, and I'm just wondering how much that fed into your thinking on this, that we can get some of these skills on the natural, but we probably better have a plan to develop them in government.
Part of that, we were also looking at it educationally by establishing that through like the Common Core. That's one of the components that's necessary for working when students graduate on a global economy scale. So that way they already come out with that skill set and the ability to not only interpret but understand the data. So by incentivizing part of that would be also having open positions where they're able to move into, we can utilize that resource. And starting a ground movement on that, where now change is driven by data, and it's data decision making that's really the force that moves it. And the prior conversation that was also included was that having those individuals that are in the smaller agencies and the nonprofits and those companies that are really have the information, they have the hottest stuff. And so by being able to drawing them in, that really incentivizes change in itself.
Great. Mike or Jim? Jim's got the mic right now.
Organizations that we work with when they want to be involved with skills development or training run into two immediate challenges. One is training is expensive, and the second is you have to be pretty clear about training in what specifically. What are the exact skills that are going to serve you best for whatever goal you have down the road? So I'd be interested if I mean, I'm sure, Mike, you think about these issues because you, at the agency level, in terms of resources and focus on training issues. I like a lot this list and the objectives, but those are two kind of immediate challenges that any organization that's trying to build up skills will confront.
Well, when we talked about this, that was the whole reason to basically have a competency set developed, and we didn't want that competency set developed by academia or by government or by business like in a vacuum. That's why we chose philanthropy to convene that and begin to develop it, because they don't really have the same kind of motivation in the game. And if we can develop that core set and identify what those skills are that we need, then we can go forward not only with training existing workforce, but also then reaching and thinking long-term back to our students and bringing them along. It gives us an opportunity to change our employment structures, and that's the only way you're really going to get institutional change.
I want to make sure we have a moment in the sun as well for Group 4, but before I do, if we have a question out there for building up the skills, raise your hand, raise your body so I can see you.
I know I started, I like broke the seal or whatever. So only that when you think about the content in the training, I think there are just some biases that exist, some misinformation. You talked about being converted, right, to being about open data. There's a lot of that that's out there, and I think just the basics, some myth busters, some, vocabulary. Here's what we mean when we say data. Even I would include silly things like, data are, data is, get people practicing using that, kind of make it fun, just start the dialogue. I think you have to start there. I mean, you just have to start so basic, because these words, they mean so many different things to different people, and not everybody, to your point, has the skill set today. That's why we're doing this. So you got to find a way to meet them where they are, and I think that kind of Mythbusters basic vocab is key, in addition to the process stuff and the how to get involved, which I think also has to be core to that curriculum.
All right, and maybe just to add one more comment to that, that's sort of the idea we had in mind too when we recommended the data stewards a little bit. That's kind of the grassroots initiative where you can have department staff taking ownership for some of the data, some of the training programs, some of the sort of the grassroots knowledge, and sort of spreading it throughout a department. So just sort of fostering that.
Great. I want to thank Group 3. Thanks, you guys. So let's bring up Group 4, collaboration. Right? Okay, collaboration. How can we improve collaboration, that is? Hey. All right. Let's hear. Oh, did we? I forgot to ask. Group 3, did we do the tagline? We did. Okay. All right. All right. Sorry. Let's just move on then to Group 4 for collaboration. Tell us what you got.
All right, so we talked about how open data can foster collaboration. So we came up with 5 recommendations. The first is to create best practices and guidance for dissemination. So things like provision and development of toolkits for how to use the data, and promotion of interoperability standards, which was something that somebody else spoke about up here as well. We talked a lot about champions, so use of champions, identification of champions, and mentoring of champions to promote collaboration and to promote open data across various entities, whether that's within the government sector, across different sectors, going into the private sector, nonprofits and whatnot. Again, engaging in also mentoring those champions. And then the third recommendation was to set privacy threshold discussions and direction for open data. Then through legislative sponsorship, work to harmonize privacy laws with data sharing needs. We were very specific about that one. And then the fourth is engage multiple entities. So internal, external entities, as well as broader folks within the community, within the context of the supply chain of solutions, so that we can understand sort of the common threads across different entities. Why do different entities need the data? So we can have some type of common theme and identify ways to work towards common goals. And then 5, to resolve siloing of data. There should be an expectation that data sharing is bidirectional. So it's not just me, but hey, if I have data for you, you might have data for me as well. So let's encourage bidirectionality across sort of data sharing agreements and whatnot.
I want to ask a question about number 3. Not that I mean, this is obviously a big issue. Doing my work in open data, I know that privacy is one thing certainly that can keep data from being freed. In some cases, rightly so, like we just talked about. But I want to get a sense from you about the tie-in to collaboration there, just how the conversation went, and how you thought privacy and that conversation, or that issue related to collaboration.
I think and please, you guys feel free to chime in, but it's something that prohibits potential sharing of data and collaboration across data entities. It's tough when you start to think about there are laws that really prohibit use of specific types of data, and that might scare folks off. So we've heard from Mike before that there's this sort of the high-hanging fruit is the HIPAA data, but sometimes maybe that's not always clear in terms of where is the threshold, where does that cut off. Where is the cutoff?
Yep. Thank you for clarifying that.
Also, I think part of that discussion needs to revolve around I think, did we use the word harmonizing there? But harmonizing sort of these privacy conditions, security conditions across programs and groups so that there's an understanding. And there might be different categorizations of data. You've got administrative data, you've got surveillance data, and you've got personally identified data. And maybe there needs to be a common understanding of the different thresholds there.
Mm-hmm. And we did a lot of harmonizing between the 3 different tables, and one of the things that, we had to do a lot of consolidating, I'm sure you all did. One of the things, so in our group talking about privacy, it really was about the first thing that comes out of risk is risk-based. So it's the fear, it's the no before the, well, let's see what is possible. So along those lines as well is what we were talking about.
And what's your tagline or headline?
We couldn't come up with just one. We couldn't
Collaborated.
collaborate here, so we've got 3. So this one tiny trick opened all data in California was one. Everything changes when you see yourself in the data. And then the third was Chicago follows California's lead in open data standards. There, everybody got it. There you go.
That second one, of course, is what you talked about, Elizabeth. I like that one, too. Let's start with Jim, actually. Let's go back to the recommendations page. Thank you. When you look at some of this in the collaboration, what's striking to you?
One thing that strikes me, again, these lists are terrific. And number 2, the one talking about champions, again, in other jurisdictions at the federal level and other states, I've seen this having champions or ambassadors for this movement is absolutely critical. And there have been a number of pretty high-profile ones. You think of Todd Park or Brian Sivak, or I think Nirav Shah. I'd actually put Andy in that category. There's a number of people that just say, we really have to do this, and here's why, and they're credible, and that gives the permission that people really need to move forward with this. So that role, at the agency level, at the department level, I think is mandatory. It's critical.
And one of the things, just a quick observation that I think is that seems to be taking place here in California is when you think of the federal government and open data, you think of Todd Park. When you think of New York State open data, although he left, you thought of Nirav Shah. And here in California, I kind of like the fact that there are multiple champions. We've heard from some here, chief data officers like Abhi Namani, or folks at a state level like Michael. It's just, I think that's a good thing that we have multiple champions, and it's not incumbent on one person to do this. But Stuart, what strikes you from looking at all this?
Well, I like the bi-directional notion. I think that anybody who has data has to understand that somebody else could probably benefit from it, and that it's just not appropriate to ask somebody else to share your data without being prepared to offer up your data in response. And something that really struck me in the discussions this afternoon is the power of letting other people see the data that you have. And we were talking about different ways to layer this and create opportunities, but the collaboration of just seeing 1 or 2 more layers, you could actually see a lot more about a much deeper understanding of the challenges, but also possibly solutions. Like whether it's people aren't using a park because the bathroom hasn't been fixed for 3 years or something. Layering in different data from different departments is you don't know what's going to happen. But so people should be prepared to cough up their data when they're asking.
What about, Elizabeth, you work with, say, city planners. There should be part of this collaboration. When you look at these kinds of recs, how do you think they want to be involved in this?
Well, I have to admit, I was in this group.
Well, that's true. You're a little
a lot of the
biased,
recommendations actually, I agree with them all. They're great. We talked about them a lot. No, actually, this morning I had to step out to be on a call, and I was on the phone with, we're doing a panel for a planning conference, and so, it was someone who's from the Air District, and someone who's a land use planner and a lawyer, and an urban planner. And I actually asked them, I said, I'm on this panel today and it's talking about data and we're all talking about these things. What do you need? And what they said was, this is one of the reasons that I'm involved in this, is because when we were doing local outreach and we're trying to talk about healthy communities, it's like, how do you move that forward? How do you know where you're going, and how do you integrate all the data sources, which is why I was pressing on that question to see for the cross-sector piece. So I think that these recommendations, they would really resonate with. The other thing that I would say is the supply chain. Just through some of the conversations that we've had today, I was talking with Michelle, it really reminded me, after the panel that she moderated this afternoon, of a conversation I was having with the venture capitalist, and it just it sparked the same idea in my mind, that if they're going to fund something, they want to, it's going to be much more successful if you're integrating that into an existing supply chain, rather than having to start something and then create a whole new mechanism. And I kind of liken that to the open data work of figuring out, that's, again, going back to the previous Fishbowl panel, of multidisciplinary work. What are some of those places? Who are already looking at the data, and how are they using it, and how could this help? And so we're doing a lot of work with the Department of Public Health and the local health officers, and data is going to be one of their big things as they're kind of moving forward from chronic disease prevention. So I think they would resonate with this. I think it's a matter of starting to move the ball down the field.
Great. Mike, what about internal collaboration across departments, the silos that you talk about? Those silos perhaps are the departments. What are you thinking about when you talk about your role in this?
Well, you would think that inside of government that you could share data, and it's absolutely not the case. The number of conversations I've had between the Department of Healthcare Services and Social Services about sharing data about the same people, and some of it's historical, some of it's just a siloed mentality, some of it's federal. There are federal rules around sharing some of the data that they regulate, and so and we have all of these data sharing agreements that take incredible amounts of time to negotiate out. And they're very specific about particular data sets and how they can be used under what circumstances. So that's one of the things that we've been trying to figure out is how to streamline that. So really trying to figure out how to make sure that the people that need the data have access to the data and in the appropriate form, the appropriate format with the appropriate controls. So we want to make sure that we aren't doing something that's going to result in the data being posted externally. But if you have people that are dealing with the same sorts of issues across the departments, that they should have access to that data, and it shouldn't be really cumbersome to do so. We just need to make sure that we have the right structures in place to assure that we aren't going to do something incorrect with the data.
Yeah, this reminds me of recommendation 3, what you're talking about, and it's interesting that in some cases the regulations and laws that are meant to protect us as citizens from being, name being released, et cetera, also perhaps are preventing some of this collaboration, which in turn can help solve some of the issues that we collectively face. Okay, so I know we've got to turn it over to the very end, but before we end this panel, I want to give an opportunity. Anyone have a comment that they want to express about collaboration? Yeah, right over here.
I just want to quickly state the obvious because I'm good at it. I'm struck most of all, very good recommendations, I think, a lot of good thinking throughout. I'm struck by how many common threads there are. I think if I were involved in shaping policy for California, one could easily start with saying, well, all these minds got together separately and look at how many things they said that were similar or certainly fit under the same umbrella. And that seems to me a terrific place to start.
Great. Well, I want to thank all the panelists, all the fish. Oh, hold on, Elizabeth.
I was just going to say one more thing, because I think the piece about leadership has come out. It's come up in like the visionary leader and having the leader and I think that's really important from the top, but I think the other piece is how important that every single person, no matter where they are within the organization, is for this kind of work, is really leading this charge and this change. And so I just wanted to add that in. I mean, I think that the top is really important, but I think also really supporting that from the bottom.
I think that's right. Any other final comments from any of the panelists? Wonderful. So, great panels. I want to thank you guys. Really terrific job. I want to thank all of the groups, those that reported out. We're all fabulous fish.